Heart attacks are an unfortunate reality that we hear about far too often. But do athletes, or those who are fit and athletic, need to worry about heart attacks? Just last week, I received several calls and text messages informing me that a colleague from IOHA, whom we'll refer to as my friend, was hospitalized with a possible heart attack. This individual was undeniably fit and athletic. In today's video, we'll delve into what actually happens during a heart attack, examine whether fit and athletic individuals need to be concerned, and explore if those who do experience a heart attack can recover to the point where they can once again engage in sports, run marathons, and participate in other physical activities. This episode promises to be enlightening, so let's dive into this anatomical exploration. Let's begin by examining a human heart to understand what happens during a heart attack, and then discuss the risk factors, particularly for those who are fit and athletic. As we know, the heart is located in the thoracic cavity between the lungs, encased in a pericardial sac. The outer layer I'm touching here is called the epicardium, which consists mostly of epicardial fat. However, the heart on the tray has had its epicardium removed to reveal the thick muscular layer known as the myocardium. We've made some incisions to look inside the ventricles, which we can explore further in another video. The myocardium, literally meaning heart muscle, is our primary focus when discussing heart attacks. Heart attacks, technically known as myocardial infarctions, involve the myocardium, our heart muscle. The term infarction refers to an area of dead tissue caused by a lack of blood flow. During a heart attack, portions of the myocardium can die off due to insufficient blood supply. So, how does the heart receive its own blood supply? Let's take a closer look at this heart model. Here, we have the aorta, the largest artery in the human body, comparable in size to a garden hose. The first branches from the aorta supply blood to the heart itself. These include the right coronary artery, which branches to the right side of the heart, and the left coronary artery, which sends branches to the left side. If a significant occlusion or blockage occurs in one of these arteries or branches, it can lead to a heart attack. Heart attacks don't occur suddenly. They are often preceded by risk factors or other conditions, with a major one being atherosclerosis. Atherosclerosis refers to the buildup of plaque on the inner walls of arteries. These plaques can vary in size, from small to large and severe. Smaller plaques may not significantly obstruct the arteries, and many people are unaware they have them since they often do not cause symptoms. This highlights the importance of regular health checkups, including physicals, blood work, and monitoring cholesterol levels. As plaques grow larger, they can eventually cause symptoms. One common symptom in the presence of larger plaques is angina pectoris, or stable angina, characterized by chest pain due to reduced blood flow to the heart. Angina pectoris, or chest pain, is often referred to as stable angina due to its predictable nature. When someone exerts themselves, such as climbing multiple flights of stairs, they may experience chest pain. However, this pain typically subsides with rest. This predictability, pain with exertion, relief with rest, earns it the name stable angina. The underlying reason is that the plaque-induced blockage in the artery is significant enough to restrict blood flow during physical activity but not during rest, when the heart requires less blood. Stable angina, while not a heart attack, significantly increases the risk of one. A heart attack typically occurs when a plaque inside an artery ruptures. It's important to clarify what is meant by rupture. When we talk about plaque rupture, we are not referring to the artery itself tearing open. Instead, it's the inner lining where the plaque has formed that ruptures. The outer layers of the artery remain intact, preventing external bleeding. When the plaque ruptures, the body responds by forming a clot. This clot can quickly build up within the already narrowed artery, further restricting blood flow. If the clot forms in a key branch of the coronary artery and blocks blood flow even at rest, this leads to the deprivation of blood and oxygen to parts of the heart muscle. If this deprivation continues, it results in the death or damage of heart tissue, marking the onset of a heart attack or myocardial infarction. Many of you are likely familiar with the typical heart attack symptoms: central chest pain that radiates to the arm, neck, upper abdomen, or back. Other common symptoms include sweating, diaphoresis, anxiety, nausea, and more. But what happens when someone arrives at the hospital with a heart attack? Almost every patient will be given aspirin, a blood thinner. Many patients will also receive nitrates, which are vasodilators that help open up the heart's arteries. Stronger blood thinners or anticoagulation therapy may be administered to slow the progression of the clot. Beta blockers and statins might also be involved in the treatment process. However, most heart attack patients will eventually find themselves in the cardiac catheterization lab, known as the cath lab. The cath lab is where cardiac catheterization procedures take place. Before diving into what happens in the cath lab, it's important to understand the difference between a mild and a massive heart attack. A mild heart attack involves smaller arterial branches with smaller clots, which, while serious, are less severe compared to a massive heart attack. The term widowmaker refers to a heart attack caused by a blockage in the left anterior descending artery, a major branch of the left coronary artery. When this large artery is blocked, it deprives a vast area of the heart of blood, which can be life-threatening. Patients with such severe blockages are prioritized and rushed to the cath lab immediately. In contrast, those experiencing a mild heart attack, who respond well to medications and show improving symptoms, are triaged accordingly and may wait longer for their turn in the cath lab. In the cath lab, doctors can perform procedures such as angioplasty to open up blocked arteries or insert stents to keep them open, effectively restoring blood flow to the affected areas of the heart. The triage process ensures that the most severe cases are treated as quickly as possible, while those with less critical conditions are still carefully managed. In the cardiac catheterization lab, an angiogram is performed using an X-ray machine and a special dye that illuminates the heart's blood vessels, allowing the cardiologist to see them clearly. The cardiologist inserts a catheter into the radial artery, although the femoral artery can also be used. The catheter is then navigated up to the heart. With the help of the imaging, the cardiologist can identify areas of narrowing or blockage in the arteries. They may then perform an angioplasty to stretch the narrowed part of the artery and place a stent, a metal mesh, to keep the artery open permanently, thus restoring blood flow. For those who have suffered a heart attack, the future of their fitness and athletic pursuits can still be bright. Many individuals who have undergone an angioplasty and stent placement go on to participate in rehabilitation, make lifestyle changes, and eventually return to physical activities such as running marathons, racing, and playing sports. Having a heart attack doesn't mean the end of an active lifestyle. With close monitoring and communication with their healthcare team, many can successfully return to their fitness routines. This video aims to educate and provide hope. If you have specific concerns about yourself or someone you know, it's essential to consult with a healthcare provider. That's an overview of what happens during a heart attack and the potential for recovery in athletic individuals. It's crucial to stay vigilant about our health, but it's also possible to regain fitness after such an event. If you found this video helpful, please like it, subscribe to our channel,